asked the question a few days ago to name all the reasons you can think of that could lead to inaccurate pulse ox results. It has become very commonplace in the medical world for us to use pulse oxes, and for good reason. For the most part, they are reliable. They give us a quick reading. They give us a trend of readings. They're not invasive. They're an invaluable tool for patient information and their oxygenation status. However, we take care of many patients that have many things going on that will lend an inaccurate pulse ox reading. Now, so let me say, before I say anything else, if your patient has a pulse ox level, because I have seen it before, I have seen beautiful pleth waveforms, pulse ox of 99%, and the patient is diaphoretic, using their accessory muscles, tachypnic, not looking good at all. But gosh, they have a 99% pulse ox, but I'm treating this patient, not that monitor. Regardless of the manufacturer, the type of probe that you're using, you're going to have a probe that has two LED lights. One reads pulsatile blood flow, one reads non-pulsatile blood flow. Since a pulse ox is reading the difference between pulsatile and non-pulsatile blood flow, it stands to reason that any condition that reduces the blood flow or restricts the blood flow to the area of the body that pulse ox is on, you're going to have a decreased ability for that pulse ox to pick up a reading. So a patient is in shock, they have vasoconstrictors, hypothermia, severe hypotension, patients that are septic. So those patients will have peripheral blood flow that is severely, in most cases, decreased. So it's not going to do you a lot of good to put a pulse ox on an extremity. And in those times, you want to use a true ear probe or a true nose probe. I have a soapbox. I will make a video about it one day about using the right probe on the right part of the body, because 50% of the time they will give you a false high reading. People that have a darker skin tone, again, it's not necessarily that big of an issue until they become more cyanotic and maybe their nail beds are a little darker, and it does create an issue. Patients that have dyshemoglobinemias, what a great word. I love that word. So we know that a pulse ox reads oxygen bound to hemoglobin. So if your patient has an abnormal hemoglobin condition, your patient can have fully saturated red blood cells, but it's not oxygen. So I'm talking about carboxyhemoglobinemia. So patients that have carbon monoxide poison, you'll see these patients, they are bright red. Their pulse ox levels are 100%, but it is not oxygen that is bound to their red blood cells. It's carbon monoxide, which does have a higher affinity for the red blood cell. So your pulse ox is inaccurate. Methemoglobinemia, I have seen this before. This comes from several different sources. The patient that I have seen the worst in this state had a benzocaine that was sprayed in the back of her throat over and over and over for a procedure. And her methemoglobin level was between 50 and 60. She was blue as the day is long. Pulse ox level was 85%. The nurse just thought she just needed an auto breather, and it was not going to help her. 100% oxygen is not going to help your patient. It's in methemoglobinemia. And then sulfahemoglobinemia, which is very rare. Again, you've got to have a co-oximeter when you run a blood gas on these patients to make sure that you are aware of any abnormal hemoglobins. And also patients that are severely anemic. So we're talking about patients that have a hemoglobin that is less than 7. They can have a pulse ox of 100%, but that's because all of the hemoglobin that they have is saturated with oxygen. But they are in a severely compromised state. They do not have enough oxygen being carried to their tissues, which is the goal. So you will have a high reading, but your oxygen carrying capacity is very low to your tissues. So if there are Any specifics that you want to know about pulse oximeters and false readings, comment down below. So make sure that you follow me here because the Pulmonary Project is dedicated to educating you about cardiopulmonary topics.